Are you experiencing lingering symptoms after recovering from COVID-19? You may be wondering what's going on. There's a term for this: long COVID or post-COVID conditions. This isn't just your average recovery phase, it's a condition where symptoms persist, not just for days, but for weeks or even months after you've overcome the virus. It's not simply a prolonged bout of illness, but a new health challenge altogether. You might be dealing with what is known as long COVID. So, what exactly is long COVID? Well, it's not as straightforward as you might think. Long COVID, also known as post-COVID conditions, is a bit of a mystery that the medical community is still trying to fully understand. It's a condition that can linger for weeks or even months after the acute phase of a COVID-19 infection has resolved. Imagine feeling like you've overcome the virus, only to be faced with a persistent cough, nagging fatigue, or constant brain fog. The unpredictability of long COVID is what makes it particularly challenging. The range of potential symptoms is broad, spanning from physical issues like difficulty breathing and pain, to cognitive problems such as memory loss. It's not just a physical ordeal, it can affect every aspect of your life, from your work to your relationships. In essence, long COVID is a continuation of the virus's impact on your body. What symptoms should you watch out for? Now that's a question that needs answering. Long COVID has a range of common symptoms. Fatigue is a big one. It's not just feeling a bit tired, we're talking about a deep-seated weariness that doesn't improve with rest. Then, there's difficulty breathing, a sensation of not getting enough air. Brain fog is another symptom. This can make it hard to think clearly, causing forgetfulness and confusion. Pain, which can occur in different parts of the body, may also persist. And let's not forget about sleep problems. These could range from insomnia to oversleeping or disrupted sleep patterns. Remember, these symptoms can vary widely from person to person. Some might experience only one or two, while others may have a combination of several. It's also important to note that these symptoms can come and go over time. These symptoms can be disruptive, but awareness is the first step towards management. So, who is most at risk of long COVID, and how do you manage it? When we talk about who's most at risk, it's important to note that anyone who has had COVID-19 can potentially develop long COVID. However, some people are at a higher risk than others, particularly those who had severe cases of COVID-19. It's not yet entirely clear why some people experience long-term symptoms, while others recover quickly, but ongoing research is striving to provide those answers. Now let's shift gears and discuss management. Unfortunately, as of now, there's no definitive cure for long COVID. But don't let that dishearten you. There are treatments available that can help manage the symptoms and significantly improve your quality of life. Physical and occupational therapy can be beneficial for individuals struggling with fatigue, difficulty breathing, or other physical symptoms. Therapy can help you regain strength and learn strategies to manage your symptoms. Medication is another tool in the toolbox. Depending upon your symptoms, your doctor might prescribe medications to help manage them. This could include drugs to control pain, aid sleep, or manage other specific symptoms you're experiencing. Lifestyle changes are also a crucial part of managing long COVID. Regular exercise, a healthy diet, adequate sleep, and stress management techniques can all play a role in helping to reduce symptoms and improve your overall well-being. While there's no definitive cure yet, there are ways to manage symptoms and improve your quality of life. What should you do if you think you have long COVID? That's a question many of you might be asking. It's crucial to remember that help is just a doctor's appointment away. If you're feeling the lingering effects of COVID-19, such as fatigue, difficulty breathing, or brain fog, it's time to take action. Don't dismiss or downplay what you're experiencing. These are real symptoms and they deserve real attention. Reach out to a healthcare professional who can guide you through the process of getting a proper diagnosis. Discuss your symptoms in detail, ask questions, and explore treatment options. Remember, there's no one-size-fits-all answer to managing long COVID. Each person's journey is unique, and your treatment plan should be too. It might involve physical and occupational therapy, medication, or lifestyle changes. You're not alone in this, and there's help available. If you think you're experiencing symptoms of long COVID, don't hesitate to reach out to a healthcare professional.